Welcome to the weekly checkup on ReachMD for the week of October 5th, 2015. This week's news segment addresses an important update for female cancer patients considering becoming pregnant. A new study recently published in the New England Journal of Medicine argues that cancer treatment is no longer a reason to terminate pregnancy. Findings show that prenatal exposure to chemotherapy and other cancer treatments did not affect normal brain or heart development. While risk factors should always be considered before taking any form of medication during pregnancy, this recommendation could revolutionize obstetric care for women with cancer. For more information on similar topics related to oncology, gynecology, and prenatal care, head to ReachMD.com. This month's editorial focus is on nutrition. Learn how to tell the difference between good calories and bad calories in a new twist on weight gain by popular journalist Gary Taubes. And now for a quick look at some of our latest featured content. Female athletes embody toughness and peak physical conditioning, but they need healthcare advice too. On Primary Care Today, check out a compelling conversation on the special health considerations you should take into account for your female patients. After breaking a sweat, hear from cardiovascular experts on guidelines for prevention, diagnosis, and management of dyslipidemia in patients with HIV on lipid luminations. For more featured content, head to ReachMD.com or listen in on iHeartRadio or TuneIn. On this week's highlighted video segment, get a taste of our favorite nutritional guru, Kathy King, in this snippet from her new series, Nutrition Edge.
Today we will be discussing using a lower carbohydrate diet for better gestational diabetes control, which helps produce a healthy baby and a healthy mom. Lily, welcome to the program.
Thank you so much for having me, Kathy.
Yes, and I think people are going to be interested in how you first got into working with women with gestational diabetes, but also what's being recommended and how does your program differ?
You bet. Well, I've always been fascinated by the interconnection between prenatal diet and fetal development. So when an opportunity came my way to work with the California Diabetes and Pregnancy Program, Sweet Success, I eagerly took the position. And from there, I really got into the complexities of prenatal nutrition and fetal programming, which is how a mother's diet and lifestyle can impact the genetic expression and disease risks of her baby. And
for those of you in the Pasadena area, be sure to mark your calendars for this Friday, October 9th. Omnia Education's Women's Health Annual Visit is coming to the Hilton Pasadena. Come visit the ReachMD booth in the exhibit hall to learn more about our available programs and maybe even join us on air. Until then, I'm Sherry Neely, as always inviting you to be part of the knowledge.